Amiouche Amar is a fishmonger, originally from Algeria. He lives in the suburbs of Paris, he's married with children, and there's also now the possibility that he's one of the first people in Europe to have contracted COVID-19.
It shocked my wife, and then we saw the epidemic, the deadly tidal wave everywhere around the world. I'm blessed, honestly. The illness wasn't known back then. That's the worst thing. It wasn't known at the time. The doctors didn't know what to do. For them, it was a very severe infection. That's what was explained to me, but they weren't able to detect it.
But he may not be the only one to have caught the virus early, or even the first. A hospital in eastern France, using different tests, now says it's found a case of a man with the coronavirus from mid-November. The team of doctors which uncovered Amar's illness late last year says other hospitals have even better testing equipment that could result in more old samples coming back positive. Here is French doctor Yves Cohen.
Radio scanning is a very sensitive exam to detect COVID-19. It's better than our tests, as their sensitivity is 98%, while ours is only around 70 to 75%. So it's good it's so sensitive, and if cases were really around in mid-November, it's extremely interesting and means the virus was spreading sooner than we thought.
This raises questions about the origins of the coronavirus. Dr. Cohen says his study tells us more about the spread.
We know it didn't start in early January, but earlier. What we can say is that the pandemic wave is slower than expected. The virus spread slower. We know that we have almost 30,000 deaths in France and 1% of mortality rate for the virus. That means 3 to 4.5 million French people have been in contact with the virus.
French doctors suggest China, the US and other European nations retest old samples that could establish coronavirus cases existed across the world before the pandemic was officially recognised. Ross Cullen, CGTN, Paris.